Given that it is 3:01, let's go ahead and open up the January regular meeting for the Local Alcohol and Drug Planning Committee. My name is Eric Geyer. I chair this meeting. I'm also the director of Jackson County Community Justice. I do see that Dr. Mahan is here, and he is our featured speaker today. We're going to talk about contingency management, and you've heard my spiel at a number of these meetings where contingency management is one of those things that I think we've bandied about inappropriately in our line of work, where we say, we do that, absolutely we do that, but we haven't done it with fidelity, we haven't done it with regularity, and we haven't seen the outcomes that it can really bring. So the hope was that we would bring in an expert to talk about contingency management, what it can mean, how it can be important within substance use disorder work, within behavioral health work, and who better than our very own Dr. John Mahan. So Dr. Mahan, if you are ready to take over and be our presenter, we're very lucky to have you today. So thank you.
So, what is contingency management? And really at its core, it's an evidence-based approach, helping people change, right? And so usually when we talk about it, it's helping people follow through with some of the goals that you and the person have developed together. Often that's abstinence. Sometimes it's more harm reduction stuff. Sometimes it's not related to substance use disorders in general, but it's a way to help people change, and it's particularly helpful for substance use disorders because of some of the brain changes. I won't talk too much about the brain changes, but a little bit, because some of the positive results that some of the reasons to change just take a long time to actually achieve. So, this is the big question: how do we help people change, right? We all want people to change. I think we're all used to being able to tell people to change, but how do we really help them change? So, in terms of recovery from substance use disorders, many of the benefits, like better health, improve relationships, being more productive, those are such big things, and they take a long time to really achieve. When you're working with someone who's maybe still active in use or really early in recovery, telling them that if you change, your life will be better is really abstract. And so what contingency management does, it really brings benefits to the immediate term so that people start to see benefits of pro-recovery behaviors immediately. And why can't we just tell people to change? And why don't people just say, okay, I know there's this lifelong goal and it will be better for me. Why don't people change? It's kind of like asking everyone here, how many servings of vegetables do you eat a day? How many times a week do you exercise? We all know, we should be eating a lot more vegetables than we are, and we should be exercising probably more frequently than we are. But so many of the benefits and consequences are such long-term that it's easy on a day-to-day basis to not make those changes. And it's the same with substance use disorders or other things people want to change and have long-term goals. So, there's plenty of reasons people don't change. We know this, right? Like I talked to a patient today who wants to stop using methamphetamine, but is having trouble visualizing it because he feels that it helps him stay active, which is a distractor from his chronic pain, right? That pain is very immediate. And some of the benefits from stopping methamphetamine use are kind of abstract and long-term for him. So, really with contingency management, we're trying to treat fire with fire here. The benefits for people, right, intoxication, are very immediate with substance use. And so what you want to have as one of the behavioral strategies in contingency management is something that has positive benefits from day one of pro-recovery behaviors, right? So you got to make those benefits immediate. You got to make sure they're happening right now. You got to make them noticeable or salient. And you got to make them rather predictable. People got to know that things are going to get a little bit better if I do this. So if I do this, then that happens. That's the kind of the basis of operant conditioning or instrumental learning or operant behavioral principles. And those are the behavioral principles that underpin contingency management. And they're a little bit different than another set of behavioral principles you may be more familiar with, called classical conditioning. And that's the pairing of two non-related stimulus. That's like traditionally we think of hearing a bell and salivating. So if you ring a bell when you give someone food every day for a week, right, then when they hear a bell, they might salivate. Do they really know why? They don't necessarily know why. That's not what this is. Operant conditioning, people know, like if I do this, then this happens. If I do this pro-recovery behavior, something good happens immediately, saliently, and predictably. So we're not the only ones to know this. Who's seen this sign in our community? Yeah, Eric has.
I've driven by it. I didn't know the spin and free spin though, right?
Drives me crazy. So the dispensaries know this. This is literally, I took a picture of this. They know what they're doing, the chance that a free cannabis entices someone to go in, and if they win it, they're like, wow. The next time they walk by, they know they might win. If they've won in the past, they're going to walk in and take another spin, right? We have to be at least as good as the dispensaries in helping people change our behavior. That's my challenge to everyone here. Be at least as good as the dispensaries. And we got to move beyond just telling people to change. We got to really help bring some of the pro-recovery benefits more immediate in time. So here's an example. This is a wheel we've used on our ACT team in my practice. And it uses immediate positive reinforcers to improve adherence to treatment plan elements that otherwise have mostly really long-term benefits, frankly. So, I'll talk more about this wheel, but you see it's got some points on there and a lot of positive feedback, because I really believe in the power of positive feedback. I think a lot of the people I interact with have heard a lot of negative feedback. I think they've heard over and over how they're not meeting expectations. I think, if you go back long in their history, they maybe never had a parent even that really told them they were proud of them and they'd done a good job. And I think using those words and really meaning it goes a really long way in helping people change. So immediacy. So what's that really mean? Who's heard of a SMART goal? SMART, right? Specific, measurable, achievable, relevant, time-bound. That's the perfect kind of treatment plan objective to think about when you are choosing how to institute a contingency management program. You really want to target an element of a treatment plan or an outcome that is specific, measurable, attainable, right? Not like be a better person. Not don't overdose in your lifetime. Not be sober for the rest of your life. Something that you can measure on a day when someone comes to see you. So, often, so we talk about, reward programs or reinforcers. People have to value the thing you're giving them. Does that mean it has to be expensive? No, it doesn't. But it has to be something that someone actually wants, So examples are like, I had some colleagues doing a contingency management program for adolescents, and they initially thought, what do adolescents want? And they had CDs, and the kids were like, what do we even do with these, right? What are these really? And so you got to know your audience. They got to be things people really want. I'd obviously rather give like health food to people, but People want snacks, and so, make sure this is something people want. You can also allow people to bank points for larger items they would like. And I'll talk a little bit about kind of what we started with and what we've changed to, partially because of pandemic, partially because of other things that just work better for us with certain limitations. So this is kind of the big branch point in thinking about setting up your own or understanding what a contingency management paradigm might look like when you encounter it in someone else's treatment program or in the community. The first real branch point to think about is how you're going to reward people. And so you can use a fixed schedule or an intermittent reinforcement paradigm. Fixed is people get the same amount every time. So an traditional example of fixed is like a gift card, right? Who's used gift cards? I bet people have. An intermittent program, someone gets, for every time, like instead of every time someone successfully does something, they get a spin of the wheel. And they may get positive feedback, they may get a low number of points, they might get a higher number of points. And we'll talk more about what the difference is there. But they work equally well. The intermittent is just a little cheaper to run. And if that's important to anyone on here, it wouldn't surprise me. There has been, you hear some people worry that, oh, isn't this kind of like gambling? Well, there's no wager, so it's not. And it's been shown to not contribute to the development or reinstatement of a gambling disorder. The second branch point is to do what's called a constant schedule. And that would just be every time someone does the thing, they get one spin or they get one card. It's the same every time. An option would be an escalating schedule. And this just helps it work better. It's a little bit harder to keep track of, but if you can do it, it really helps it work. And an example would be, say, this helps people do that good thing more times in a row without wanting to skip. So if the example is you're reinforcing people for appropriate urine drug screens that don't show any evidence of methamphetamine use, say you're doing those weekly, the first week someone gets one spin, the second week it's appropriate, they would get 2 spins or 2 gift cards. The third week in a row without missing, they would get 3 spins up to whatever your max is. And this really helps it work. People, once they get up to like higher numbers, they really don't want to miss it. So here's kind of an example of the constant schedule. You do one, you get one. You miss one, you don't get anything. You do one, you get one. You do another one, you get one. You miss one, you don't get anything. And the escalating schedule, just in contrast, right? The second time you do it in a row, you get like 2 spins or gift cards. And then you can get up to like 5 and then kind of cut it, but once people get up with the escalating schedule, once people have done something a couple times in a row and they're really seeing the benefit of it, this immediate and salient reward, it's a big thing, they're that much more excited and motivated to continue maintaining that improvement. So how long, I get this question a lot, how long do you continue, and I would say, wow, keep going until at least as long as the long-term benefit of the behavior has been realized, right? You often start to see people, 3, 6, 9 months, a year, kind of achieve different levels of being pretty stoked on their life, right, with recovery. And you got to kind of at least help people get to that point where they're getting kind of stoked on their life and recovery, to start thinking about not doing this kind of contingency management anymore. It might be a long time, but why not? If it was worth it to start, it's worth it to continue to help people get there. The longer people practice pro-recovery behaviors, the more it becomes ingrained and a part of their life, and the more likely they are to really achieve some lifelong recovery or, change towards harm reduction based changes in their life that helps them live a better life or a longer life. So I talked about my act. I don't know if anyone here is unfamiliar with the ACT model. It stands for Assertive Community Treatment, and it is specifically written into law in Oregon, although it's not an Oregon-specific kind of program. We're a medium-sized ACTS team. Everyone has a diagnosis of schizophrenia, schizoaffective disorder, or bipolar disorder for the most part, and diagnoses of methamphetamine, cannabis use, alcohol use disorder are pretty common, probably 75–80%, and often complicate response to treatment. In addition to anyone accessing specialty mental health services, their most likely cause of death will be related to tobacco. So I firmly believe, it's part of our job to help people quit using tobacco, alcohol, and drugs. And like I mentioned earlier, a lot of people, they're not there for substance use disorder treatment. And so how do you really engage that population? And so you gotta make it salient and fun and something people want to do. So contingency management is pretty well suited. It costs about $10 a month per person. That's not a whole lot, and it's really made a big difference in my opinion. Kind of looking at group attendance pre and post starting this program. These are pre-pandemic numbers. Our men's group increased from average of 2 people to 9 people. Our co-ed EIMR group increased from 4 to 14 people. Our women's group increased from 4 to 7. And remember, this is the average cost of only $10 a month per ACT client. We initially used candy and snacks, but our building people found out, and so we're not really allowed to keep candy and snacks around, so we changed and doing mostly points and vouchers. Some people, really dug being able to bank points. I really think that immediate rewards are really helpful, but for people who really wanted to work towards things, bigger stuff, basketballs, CD players, headphones, that kind of things, they can bank points and save them. 500 points is $5 gift card. So 100 points is about $1. It's tracked in Excel. Most popular gift cards are Walmart, Dollar Tree, McDonald's, Subway, Taco Bell. And if you're going to use gift cards like that, just make sure, if you are buying them from Walmart, that when you purchase them, you can select that they're not redeemable directly for alcohol or tobacco.
Well, Dr. Mann, I can't thank you enough. I mean, extremely informative, very practical. I think that in terms of SMART goals, all of us are sitting here saying, these are the things I can do now, or these are the things I can enhance or move. So it was everything we could have hoped for in this presentation. And again, I think as we all continue to come together, hearing about those successes in our community where it's working, little things that, if it's not health food and if it's not CDs, is it the Dutch Bros card? I think there'd be probably some shared capital in finding out what people really respond to. So thank you so much for your time today. Really appreciate it.